call the meeting to order for Leavenworth County Commissioners. I'd like to invite everyone to stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to start with a moment of silence, please. I'd like everyone to remember what we're dealing with today. We'll roll call. We'll start with Commissioner Shimke.
Here.
Commissioner Smith is present. Commissioner Stevens. Commissioner Cause.
Present.
Commissioner Culberson.
Present.
All right. All commissioners are here in some form. Before we go to public comment, did you have something you needed to say, Mr. Lawfrey?
Yeah, first I just wanted to kind of give a little bit of a background in that the current order from the state is set to expire on the 3rd. We had indication last week from the governor's office that any new orders were going to be much more relaxed, and had made recommendation to some of the counties that they may want to be prepared if we were going to stay with a little more restrictive guidelines. At that time, it was indicated that Wednesday was when the governor was going to come out with new guidelines and information. So Leavenworth County, Johnson County, Wyandotte County specifically began working on what phases might look like locally. And that's, at that time, the health officer, myself, and Mr. Van Paris started putting together a plan for Leavenworth County. Again, under the assumption that the state guidelines were going to be much more relaxed. Late yesterday, and kind of leading into yesterday, we were made aware that the governor wasn't going to make her announcement until later today. Originally, we thought it was going to be maybe a noon time frame, but now we understand it's to be 6:30 this evening. We also had some indication from different sources that potentially that order is going to be much more restrictive than we originally thought. It might be a little looser than the current order, but it's still going to be very restrictive, which kind of puts us in a position where there is a high likelihood that the orders, the draft that we've put together, is going to be kind of a moot point, depending upon, again, what the governor comes out with. So with that information in mind, I've talked with the health officer this morning and the county counselor, and we believe it would be prudent for the county to just delay our meeting until tomorrow morning so that we can get a grasp on what the governor is actually going to put out before we take any action. And that way, if it is very restrictive and there's no need for a local order, we'll go that route. If it's not restrictive, we can always bring this back in with any amendments that reflect what her new order is. So with that, I would ask that the commission consider just postponing this meeting until tomorrow morning, at whatever time would be convenient for you all.
Any thoughts?
I think that's a wise idea.
How about we do it tomorrow afternoon, and that would give staff time to put something together?
I was planning on being here all day tomorrow, so that works for me as long as it works
Well, I mean,
with your
like,
schedules.
would 1 o'clock right after lunch do, or you guys tell me.
That would be time. I mean, one, we're going to have to receive the order, read through the order, find out what, and then see how that plays to what we need to do locally or what we don't need to do locally based on that. And with this only coming out at 6:30 tonight, again, we need some time to evaluate. So I'm open to the 1 o'clock.
So, now, did we originally think the governor was going to issue an order or make this decision earlier in the week? Was that what we originally thought?
Our indication from last week was that it was going to be Wednesday yesterday, which is why we scheduled our meeting for today, thinking we would have had the order yesterday and then we would have been able to refine our information. But we found out yesterday, obviously, it wasn't until today. And it's not only today, it's tonight. 6:30 is when the information is going to be released.
Yeah, it's interesting. She's doing it in the evening, and that's kind of odd.
I think that's when the news is on. So,
Yeah.
I mean, since we're here and we have Jamie, the health director, and the commission present, can we at least is it worth maybe having some dialogue, not knowing, again, what the governor's orders may be, but at least we kind of get, at least have some discussion points or address some of the questions we've been getting. At the end of the day, we know that anything that the governor communicates is going to supersede any decisions we would make, which is why we'll meet tomorrow. But, again, specific to this draft and this plan, we've gotten a lot of really great feedback. I appreciate all the work everybody's done to put it together. To at least have some dialogue to maybe even address either those questions, and knowing that anything we discussed today, it's really more of a work session. The reality is the governor's going to make their announcement tonight, and then we're going to meet again tomorrow, just to not waste the opportunity. I think it'd be worth it.
I think yesterday Vicki said maybe this was a work session. I think we do have a lot of questions maybe we could get out of the way. Maybe not specific to the proposed order, but just general questions, if you're open to that, Jamie.
So the concern that I have, and again, it's obviously this is your meeting, we will go whichever way the commission decides to go. The concern I have is that, one, a lot of the questions that came up in regards to this order tomorrow may be completely invalid, so that we spend, kind of like Johnson County ended up doing, having a 2.5-hour meeting that ends up being for no reason, because, again, the governor's orders are going to be, from what we've been indicated, stricter than anything that we're contemplating anyways, so we won't even put an order into place. And then the questions that arise from her new order could be completely different than what ours are. So while I had that very conversation with the health officer this morning, is we have a proposal, maybe we go through this proposal, and that way we have at least a game plan. But I think he made a valid point that that could be an hour and a half to 2 hours today, and then that ends up being for no reason because the governor's orders, we may not implement
But at some
anything.
point, we're going to have an order. At some point, it's not going to be the state making the decision for Leavenworth County from here to eternity.
Maybe.
I was hopeful that was going to be today.
Well, the reality is, it's hard to believe that she would be doing something that's much more strict than anything we're talking about. For how many counties don't even have a positive case?
Right.
I mean, not 100, but 90?
Yeah.
Over 80?
From my indication, at this point, the governor's office has taken the lead through executive orders on the phasing of Kansas. From my understanding also, she is going to allow for some locality to have more stricter guidelines than obviously but it's going to be very similar to when she put out Order 20-16 that superseded any local orders. It
Right.
cannot be any more relaxed than her order. So that's one of the premises that I came in to Mark and said, we have to see what that order looks like before we can really hash out. I mean, we have a foundation that what was presented to the board in this draft it is mirroring a lot of the health orders throughout the states, locals, things of that nature. Things we were more relaxed on than other areas. Here's Wyandotte counties.
Mm-hmm. Yeah, we read through it.
Yeah, I really like the red, yellow, and green to really follow the rest of.
Some of the questions are general, though, and
I tried to keep our order very general and tried to keep it very on the should level, as more of a buy-in from the community and businesses and everything else, trying to get us back going, trying to get us in a predicament of, one, being safe as a community, but also how do we open things back up, how do we get things moving, as well as still doing all the required things to move to phases and such, not knowing what the governor's order. We were hoping that would happen, so then at this meeting we could solidify exactly how that also looks for our county order to match and mirror up to that. So until I have that, we really don't know which directions and what items in here are going to be moot points like we discussed before. So I think tomorrow is a better time after we all have time to digest what comes out from the governor. Because as Mark alluded to, we may not have to do anything, but we're at the governor, at the mercy of the governor's order.
No. That all makes sense. I guess the questions or the dialogue I was hoping to have was, there may be gaps. Let's face it, there will be gaps in whatever the governor. And then what is our position at the county? So when a mask is required or supported or recommended, or, the question about how the...
But that goes off the CDC guidelines right now, as we're all sitting here. That's a CDC guideline of if you're in an area that social distancing is difficult or you're in a confined space, a mask is suggested and highly recommended. So, again, it's buy-in from the community. We're never going to get 100% compliance.
Sure.
And we're not going to be able to get everyone out there policed on it and things of that nature. But the more that we can have compliance and the more that we can educate and push that out to those in the community that this is a recommended safety precaution. Not for you, it's from you giving it to me. And,
Right.
and that's really what we're after. And mine and a lot of those orders are going to be things, even for businesses, to do to keep their constituents safe, to keep our community safe.
I agree.
It's not to have an overbearing. That's why there was a lot of shoulds and things in there, because also we had to write it for the availability of masks. Are masks available for everyone to reopen by Monday, and would you have them? Maybe, maybe not. So it's not a shall and I can't open until I get those. There were a lot of shoulds in that document.
Right.
In other documents, as you've read, there's a lot of shalls. In other locations, in
Well, I'll use a different example then. So there's been those that said, hey, look, you can't make me do X. Well, true, and maybe we can't enforce it. At the same time, it's the businesses that we're trying to help reopen, right? So as a business owner, they can refuse you service if you decide to put their staff or their other patrons at risk. Mm-hmm. There are those that are unwilling to put their phone number down. Well, realize that I don't care what your phone number is. We're trying to make sure that if you do ultimately become positive, where you've been so that we can educate others. So it's not about your rights. It's about a common sense approach to saving others that could have been put at risk. So I feel like some of those things the state's not going to answer. And so they're going to look to us to answer. And if we don't start having some dialogue about it, then at some point we have to. And if tomorrow it's fine or next week it's fine, I just know those questions are already out there.
So, and I have some general questions that don't really apply to the order necessarily, but just are general, that would be something that we definitely could cover this morning, and I'm sure there might be specifics.
Did we, excuse me, Mike, did we let the folks know that we're going to call in, that we would be doing this? Could we get them notified?
If we're going to conduct a meeting today and conduct a meeting tomorrow, then I think we need to call and let these folks
We need to notify
have
these
their
folks that are
opportunity.
They
waiting.
didn't know either way, right?
They need to have their opportunity to have their public comment, because they were promised that. If we're going to just have the meeting tomorrow, then we will contact them and let them know they'll have their public comment tomorrow. So that
Okay.
needs to be a decision.
Well, yeah, we need to
Are
do
we
that
going to meet
because they're
today
waiting.
and meet tomorrow, or are we going to just hold this for tomorrow?
I'd say we hold our meeting tomorrow afternoon when we can make better decision with facts.
Commissioner Cos,
Yes,
did you want to weigh in on this?
I'm going to go with whatever the consensus of the board is. I'm good with tomorrow afternoon.
Commissioner Culbertson?
Yeah, this is Commissioner Culbertson. I agree. We can't really do anything until we find out what the governor is doing.
Okay. That's what I think we ought to do.
So tomorrow, 1 o'clock is good for me.
All right. And maybe our questions will change between now and then. So, what do you think?
I'm okay with that. I just had a few questions that were just for Jamie and the county councilor that weren't related to the specific order, but I can do that tomorrow.
I think it'd be more productive. What do you think, Commissioner?
I mean, I'm fine with having the meeting tomorrow. I still think we've got questions today that are going to be there tomorrow. So
People did tune into there's a lot of interest in this meeting, particularly today, because people thought we were going to do something, and I don't think it would hurt us to have a general discussion, maybe an update on where we're at on the illness, and just maybe a half-hour type update, because to tell you, I'm sure that this meeting has more interest than our normal.
Well, if we can just stick with that, but we still need to notify these folks that are waiting to be called. Can we have a recess on that, you think? Do we need to take a
Are
recess?
you going to
or
let them
come
have
back?
their public comment today, or will you want to let them have the public comment
I'd
tomorrow?
rather do it tomorrow because it could change. Some of their comments could change with the governor's order. Do you agree with that or not? Or would you rather do the public comment and then not have?
No, I mean, I agree. I mean, ultimately, if all of what we have been talking about or discussing, if part or some gets completely eliminated based on the governor's position, then while we'll take the public comment, feel free to call the governor.
Yeah.
Yeah. And we're in a position where we can't pass any kind of, we can't talk about a specific thing, order, but I think there are some things we could talk about for just a few minutes.
Is there potential that those things are going to change based on what the state does?
Probably not these things that I'm going to.
But from the very beginning, we've said, hey, look, we want to have a smart, well thought out reopening plan, and ultimately, if the governor makes a decision that goes against it, her orders supersede ours.
Correct.
So now we're saying, well, we think that the governor is going to make an announcement that's going to be equal to, probably more restrictive. Still, you're likely going to take one or the other. It's not going to be, maybe it's some combination of the two, I suppose. But I can't imagine for all those counties that don't have cases that it's going to be how aggressive they're able to get that through. But.
Okay.
And I think some of the public comments, I mean, I'm not against having the public comments go ahead today, but some of those public comments, like people saying we should be more loose or more strict, is moot depending on what the governor does. So maybe we should put, I don't want to offend any of the people but the comments just aren't going to be necessarily relevant.
Right. They could change what their comments would be. I just think we need to notify them while they're waiting on us to call them.
Okay, so if we're not going to do the public comment today,
recess.
can we do that?
Okay.
Can we go get this?
Well, Mark can just take care of that. Okay. Thank you, Mark. Okay. All right. So did you want to give us an update?
I can provide. These are numbers that were put out yesterday. State overview, we were at 3,738 confirmed cases, 125 deaths, 25,720 negative tests, 515 hospitalized across the state. That's a 14.5% positive rate. Regional look on Prepare Metro KC, that puts the MARC dashboard up that has all the surrounding Kansas City counties and puts all the cases to the Kansas City Metro. 2,271 confirmed cases in the Kansas City Metro and 134 deaths. Of those 134 deaths, 55 out of Wyandotte County and 40 out of Johnson County. And that also includes our 4 deaths. Going into local, we were at 197 confirmed cases yesterday, with 70 of those being inmates at the LCF currently. We had 47 recovered with 4 deaths. 1 of those is an inmate. And 76 cases are active, minus the inmate population, so that's kind of what we're monitoring in the community. 26 have been hospitalized, and late after the numbers came out, we were also informed that there was another death of an inmate out of the LCF that will be counted on today's numbers. With that, we had 1,367 tests, and we're at, with the 197, we're at 14.4% confirmed rate based off of our testing that we were currently doing. In our testing, we were able to increase. I know Mark gave a update, I think last week as well as this week, in regards to our private public through KU. We were able to use that, and as of yesterday, we did about 75 tests of first responders, asymptomatic first responders, bringing them in, kind of doing the sampling from Sheriff's Office, law enforcement, fire, EMS, everything else, pulled them through, and hopefully by Friday we'll have those results back off of that. We're then going to move next week into sampling out of some of the long-term care facilities and such, to try to start doing some sampling out of them to make sure we don't have asymptomatics that are in any of those. Because again, as you're aware, long-term facilities turn into clusters very quickly, as Kansas City has found at Riverbend and such. We have, since we've been operating, had the long-term facility of senior behavioral at St. John's that we actually have now has been cleared. We eradicated. There is no more. All the patients are recovered, gone. They have re-cleaned, and they're on the process now of reopening that unit. So again, by our rapid response with working with St. John's, we were able to segregate, move people, and isolate those that were affected there. We had a case of community spread at Homestead right next door to the health department. Again, with testing and working with them, we were able to get through that process with only a single patient. So again, being very aggressive with quarantine orders and such and isolation, we were able to divert that, and we also had a staff at Twin Oaks that we were able to isolate very quickly, and we had no further cases or problems at Twin Oaks either. So all of our long-term facilities that we've had to deal with and go through contact tracing, again, with very aggressive, very aggressive testing, quarantine orders, things of that nature, I think we were able to divert a lot of problems that could have arose out of those. Again, we are monitoring LCF and working with KDHE, who is and has staff members that are working with LCF and Kansas Department of Corrections. They are handling that facility. We are assisting them with testing staff and staff's family, because that's what lives in our community. So as they're identified, we're actually doing the swabs for them through our drive-through and sending those off as well. And that also allows us and helps us with the contact tracing of the families and such of where those individuals may be in our community. So we're being very aggressive with that and testing all the family members if we have somebody that works at LCF. And we're getting ready to try to expand that even further from contact tracing of the asymptomatics as well. We haven't had that opportunity until testing has become more available. So that is some of the statistics that we have. I have statistics based on age, all those type of things. If any commissioner wants that type of information, I can send that to you. We have that all available. Right now, taking inmates out, again, because we're going to be going up in numbers, I pulled those numbers this morning. We're at 80 males and 58 females is the gender breakout. Our age demographic that has really been affected the most, with kind of that median of about 25 cases, is everywhere between 20 to 70. That is all age group bracket between there has been most hit. We have only had 11 over the 70 mark, and we've had only 4 below the 20 mark. So again, the most kind of hit, if you will, is in that 20 to 60, 70 range, within the demographic. So.
And testing, how does one go about getting tested? Do they have to have symptoms, or?
If anyone calls out to and talks to the staff at first, we find out if they're healthcare provider, first responder, LCF, what they're attached to, if they've had any sort of exposures, things of that nature. And now we're starting to move into some of the asymptomatics. If they're out and about, where do they work? Are they an essential employee? We're starting to move into that direction now that as testing becomes more prevalent, then we can run some more of those type of tests, even on the asymptomatics.
Okay. And then do you have plenty of masks? I mean, I know there's some people that's made masks for your department and volunteers. Do you still need that?
Right.
Cloth mask?
The cloth mask, we are, for the health department side and those out there, we're fine with that. The PPE we're talking about is the PPE that's needed to go into close contact of testing and things of that nature, which is the PAPRs, the gowns, the gloves, the covers. That is the items that we are monitoring, what our burn rates are. Again, one of the main reasons that we do testing all at once in a drive-through at the end of the day is burn rate. So once we dress out, we can do the 75 or 100 and only have to burn through 2 sets of PPE. complete sets of PPE before you have to switch out, and that's helping us do more days of testing and such. We currently have about 50 more sets, so it's about 25 days worth of testing right now, but we do have more things coming on order. We have some other things are starting to come in slowly. I mean, we've been on top of it. We've been in a good position since the beginning for testing. We started testing actually before a lot of other health departments actually started testing through the state. One, because we had the staff that had the knowledge and already the ability to run those tests. And we already had some PPE that we've already had, lack of better terms, stored and ready for pandemics and or shots and things of that nature, that we were already in a good place for us to start off on the testing. The problem that we had was the actual test kits and being able to have enough test kits to do what we could have ran. We could have been doing a lot more testing through March and April if we would have had the test kits. Unfortunately, we were lack of better terms, handcuffed by not having the test kits and not having the ability through the state.
Okay.
Jamie, one of my concerns, whether it be any plan that's been presented or anything that the governor might require, is the sourcing of some of these products, right? I mean, again, if you're going to require employees, if you're going to require customers to wear,
It's a different type of mask. The mask that we're referring to is the N95 or higher, which is an actual, what's called a respirator. And respirators, you have to be actually fit tested. You have to have a respiratory protection plan, everything else through. What we're talking about.
Understood. I'm talking about in general, the ones that you typically pick up at any type of convenience store or you'd order online. Sourcing in general has become hard.
It is. And that's, again, why the cloth-style mask has been approved and also been recommended by CDC as an alternate.
Okay.
That is also why in our orders we basically put the shoulds and things of that nature, because we don't want people to stop trying to source those items and trying to find, because that is the best practice. This is the best way. Again, social distancing and staying away is your best avenue from not getting this virus. But we have to be realistic on what is going to be available, what is going to be readily available for all of these businesses now that may have to start sourcing this, that weren't having to source it before. Again, it's why we're saying cloth masks, some sort of face covering, things of that nature in our plan. And it's not you can't open without this, or you can't, it's giving the recommendation, and there is some lenience. And that's why I know there was a lot of questions. I was bombarded just as well as you were as commission in regards to things were left somewhat vague, and so it is also too, as you alluded to, the business owner as well to protect their own business and how they want to operate. It is not just we're going to give best practices and what should be being done. And again, best practices are going to be put out. That's what my job is to put those type of things out and try to get us back to what we need to do. But again, I understand what if they can't get it? There is, and the CDC has recognized that, and that's why they've gone all the way down to a simple face covering, and that's why those are prevalent in the area as well.
And the face covering is just basically you're protecting other people.
Correct. It is to try to slow down the droplets from you going out to another person. It is not for protecting what's coming into you, but as you sneeze, talk, expel out the droplets from your mouth. It's holding some of that back to reduce the spread. So if you're within that 6 feet, 10-minute kind of arena, it's to protect those around you from you putting that out.
Well, I think it goes without saying, whether it's our order or the governor's, common sense should always prevail, right? If you're working remotely and can do so successfully, continue to work remotely. If you are at risk, if you are elderly, if you are compromised, just because a phase one could occur doesn't mean you should participate.
Right.
So,
and I will put this out. This next phase will not change how my family is going to be within the community.
Sure.
This is not the floodgates to open, and we're not going to go to restaurants, or I'm not going to go out, and I'm not. Just because we've hit a date does not mean anything is more safe. Anything that is a big misnomer that a lot of people are seeing numbers and do. Well, obviously it's not here. No, it's what we don't know, and what we need to keep testing is how many asymptomatic carriers are out there and people that are walking around having it that we don't know, which is great for the hospitalizations and things of that nature, but still doesn't put the most at risk any lower of a risk. It's actually worse because those people are out not knowing they're ill and handing that off to the high-risk individuals and taking that back, and that's where we'll have problems. They'll go into a long-term care facility, they'll go into a hospital, they'll go into somewhere not realizing that they are a carrier, and then they will transmit that virus, and that's the problem. So we're after that boxing off the virus. We're trying to find it. That's where testing is so important. That's why we're trying to increase testing. That's why my goal out there at the health department, along with these orders and such, is testing, contact tracing. Because along with, we have to analyze whatever we're getting out of this. That means that's telling us where it's at. Now we need to find it and quarantine it to shut it down. Because if we don't, then all it's doing is out there spreading.
Okay.
So the question on the number of deaths, you said we have a total of 5.
Correct.
And of the deaths, what was the age range of the deaths?
For the age?
Yeah, the age.
The age on, predominantly they're 50 or older.
Do we have any below 50? Were there any below 50?
I don't know the one from this morning or last night. That I don't have any of the demographics of that one yet. So
Okay, but everybody else was above age
Correct.
50. Did they, of the deaths, did they have pre-existing conditions?
Correct. Yes.
All 5?
Correct.
Okay.
Well, again, not the 5th because I don't know.
Because we're not,
I'm talking about the 4th.
So the 4.
Mr. Shinsky?
This is Commissioner Carr. Jamie, by what I'm hearing you say, basically what you and the CDC and others are asking for or recommending and people being out and about, basically what you're saying is just because you can doesn't mean you should.
Correct. And that's been really the message all along. Social distancing still means if you have to go out smartly. That still doesn't mean now because anything starts opening more, we really shouldn't be going as a family out to the grocery store still. Those type of trips still should be limited because, again, those are high contact, high risk environments. The Walmarts, the big box stores, things. I'm not calling out names, but big stores like that where you have massive amounts of people that go in and out and touch things constantly. That is just a lack of a better term, a petri dish for the virus.
Well, I'm hopeful that through this, so many people have realized alternative ways to obtain, whether it's groceries because they've got delivery, or they'll bring it out to you, or you name it, that whatever reopening phase we're in, continue to do those things when and where it makes sense.
And a lot of the stores, too, have really bought on to, the masks for employees, the plexiglass for they're trying in every modality to reduce the social interaction between. You go to the restaurants or the Taco Bells or whatever, and they're handing trays out where there's no hand-to-hand touching and things of that. There's gloves, there's masks, there's a lot of those type of things happening. I think we can still do better. That's always, we're learning. We're all learning from this. This is a culture change for all of us. As we all sit here with masks, it's a culture change to sit and breathe and talk through. As weeks go on, it becomes more natural, and it'll become more of a natural response. I hope we don't have to always remain in masks. That's not what I'm going after, but the more that we think about it before we do it, the more it's going to be a sociable, acceptable practice, if you will, for going into a store. The first person that wore the mask into the store, everybody looked at him. Now you're looked at if you don't wear the mask going into the store.
Correct.
It's that type of philosophy, thought process, and change. And again, just because we're looking at loosening orders or how this is going to change, it really, as you alluded to, if you are a person that has 60 years of age, immunocompromised, heart disease, all those type of things, you should still be social distancing yourself even further than the others. Protect yourself. You still have an obligation, like you said before, it's common sense. But our job also is to help educate from the public health standpoint, is to try to educate on that as well of stay put, stay healthy, and that's what we're trying to get the message out.
I think some of the questions that have come in about, they get really down into the I don't want to say the weeds, but into the details of, well, why isn't this in your order and this in your order? A lot of the professional organizations and the licensing boards have put out very specific guidelines for organizations like beauticians and cosmetology and barbers. The USDA has I think it's about a 25-page document on how food preppers and handlers should be dealing with this. We can't possibly include all that in any order we put out. We're just saying, those sources are out there for your organization. Go find them and use them. When we were putting ours together, we were going through some of the USDA guidelines, and it's like, these are all great, but I can't add 25 pages for a restaurant. That's where they have to take that initiative and go get that information.
They have to be accountable, sure.
And that's the common sense thing too. And it's the other thing that we discuss in this is one of the other questions that came in is what's the enforcement on this? Well, the speed limit's 75 miles an hour on the interstate, and if you drive 75 or if you drive 80, you're probably having people blow by you all the time. It's voluntary compliance for 90% of the time. It's that 5 to 10% of enforcement that you hope you don't have to have, but it's the people who are egregiously not following the rules are the ones who can expect some type of enforcement. And you may get away with it for a while, but you don't always get away with it. But we're asking people to voluntarily comply, regardless of what, if you think the police are coming by your house or by your property to enforce this, you should voluntarily comply. That's the other common sense part of this, and that's the rules that we're putting out there is, like Jamie said, best practices. Do them to protect yourself, regardless of what the other rules say. Even if it's loosened up, it's still the best practice to protect yourself. Even if we say, yeah, you can have 25 people in your business, the best practice is probably still to limit it to no more than 3 or 4 if you have a very small business.
I think you'll have, again, based on all the business owners we've heard from, I think they're going to be the ones that are helping to monitor and police and manage this. Patrons may not be as keen on some of these ideas, but those businesses' livelihoods have been taken away several weeks ago. So I assure you they're going to be very focused on trying to do things the right way.
They're also the ones who've reached out to us and said, hey, these guidelines exist. I can't remember the gentleman's last name. Carlos was his first name. I think he was one of our public comment people actually today.
With the
barbershop. He reached out to us and said, hey, the cosmetology board has put out these guidelines that everybody that he's aware of intends to comply with, and that's what we're encouraging. That's when we start to reopen this, that's what has to happen.
And I think, and we've had these discussions, but the reality is, it's never going to be perfect. The numbers are going to change. It's going to be fluid. Week to week, there may have to be amendments or changes based on what we learn or what's happening in the community. So this isn't a one-size-fits-all, and it's not a so it be said, so it be done, whether it's the governor's rule or our ruling. So I hope people can keep that in mind while we're trying to get businesses back open. Again, we can't control what the governor does.
Well, we just need to be clear when ours starts, when we do decide exactly when it starts, and contact information for people who have questions, whether it be on the website, or a phone number, that people can get their questions answered.
I do think it's worth saying that regardless of what the governor announces, these best practices that we continue to talk about are likely going to be in place either by governor's order or by county order. So, as a business owner, start to secure, if you haven't already, these things, or try to find sourcing for them so that ultimately whatever that date is, the governor's or ours, we can start working towards it. Don't wait till the last minute, because that'll make it tougher.
I agree with that, and I heard from a business owner in Tonganoxie yesterday, and they said they are very supportive of a soft opening, for us to kind of see how things go as far as the numbers and everything. I did have a couple questions on this is from a healthcare professional. How are you normalizing data related to positive test results over time? Is it important to account for the difference in the number of tests performed when assessing increases or decreases in case rate?
From what I'm hearing is what we're talking about is trending. Trending data is what they're referring to. We're looking, in one of the key parts of phasing is a 14-day trend down is what they want, because those are incubation periods. So again, as we look back all the way to May 17th when we received our first cases, obviously all along we've been trending 14-day data. We're also trending now as we are testing more. But what we're looking off of is that percentage of positives going down. That's what you can also look at, is where the state level is at 14.5%-ish on positives based off of testing. We're at 14.4. Well, one of the things that as we increase testing, does that number start to go down on what we're popping on positives, or are we going to start to see that follow and trend with the amount of, and that's what we have to look at as the amount of numbers of cases that are out in our community. The answer is yes, we are trending that, and that's how we're looking at. We're not just looking, if you look at our graphs when you just add them per day are always going to continue to go up. It's not going to do a hump like people are thinking. What they're looking at is you got to look at the trending hump of cases by day and what does that look like, and what we want to see is that to start to go down as we move forward, and that's how us quarantining and boxing that in and being able to isolate, and it doesn't keep expanding out, we're going to see that go down as we're testing more.
So Mike, you're saying if yesterday you test 50 and today you test 100, you're going to have more positive cases.
Right.
However, if it's a 10%, as it was 2, 3, 4 weeks ago, or a 14%, that's the number that's probably more relevant rather than the total number of cases.
And
that's how you balance that. That's how you can balance that off of increase in tests or decrease in tests. That percentage of what has that been over the last 14 days, and that's how we're trying to monitor that.
And here's another general question is, do we understand the distribution of cases so that we can create effective target prevention strategies, i.e. the number of people in nursing and senior living facilities, number in the prisons, and general population and age? I think you've addressed that, but do we have specific mitigation for some of those populations? Like, what are we doing in nursing homes?
Nursing homes are basically following all the CDC and state guidelines right now of no visitors, all staff that come in and out of nursing homes, temperatures are being taken, things of that nature. So in essence, nursing homes are really on the lockdown, and that's really where we need them to remain. And they're going to be one of the last if you look, because that is your core, high risk clusters that could happen if you again, as I talked about before, we had 3 scares when we had those individuals in, but because we were diligent about going in with those strategic plans and saying, we're your partners, we were early on with all of these facilities within our county. They have no problem calling if they have problems, concerns, testing, all of that type of stuff. We're dealing with them on a one-on-one basis throughout the week, the days. So if a case comes in, we get in there immediately. If we need state assistance, we go in with state. And that's how we address those high long-term.
Do you see a time when maybe family members could be tested or something? I mean, we have family members that are separated from their loved ones for, now, 6 weeks now? And do you see maybe a time down the road when if you're tested or we have it, and that raises the question of antibody testing, is it? Right. Do you project a time out on that, or do you think that we're going to see these folks locked down for the foreseeable future?
I'm going to say for the foreseeable future, they're locked down. Antibody testing is something, again, CDC has put out some new papers, guidance. They're hitting that hard. I mean, that's going to be the next phase that we see through on testing that we're going to have to ramp up once it comes available. FDA has to get involved. They're still working under the emergent testing criteria. So basically, the FDA has given emergency clearance for certain test kits. There are several companies out on the market. Not all of them have the FDA approval. There are very few. Abbott is one of them, as most have seen in the news and such. But until that becomes so widespread and available, again, we're just seeing testing for the PCR testing, the nasal swab and the positive. There's no, not in the next several weeks are we going to see any sort of serology that we're going to be able to conduct at the health department or locally. And then secondly, CDC is still trying to evaluate what is that data once we receive that, does it truly mean? Other than, yes, you may have been exposed, but does that mean that you are actually going to have the ability to fight off the virus if you, or does that mean you had enough within your body and such? So there's a lot of, you can go to CDC, you can download the document, it is there. It talks about what we want to know from serology, what we can't know from serology yet because there's not enough data, but they're working on that. And I have a loved one in a nursing home that I haven't been able to see. So
Right.
I understand wholeheartedly what that means, but that is also such a high risk into those that we would have to 100% make sure that whoever's going in and out doesn't bring it in, because that's the only way that it's going to go in. Those are not individuals that are going out into the community, so it's going to be brought in from somebody into there. And most of the clusters in the state are in those type of scenarios. It's either a nursing home, a prison, which are all the same style environments. Something has to be brought in, but once it's brought in, it's like, again, a petri dish, and it just goes like wildfire, and we have a big problem because those are all high-risk individuals in a nursing home.
Well, so that brings up a question. I know that as a whole, it's a higher risk population of people, but it seems like if you look across the country, you have states that have higher populations, higher densities, maybe more impoverished communities, and they get hit the hardest. I'm curious. So conditions obviously play a part in this, and I'm like, is it, maybe a prison is less surprising to me as far as conditions than, say, a nursing home could or should be. Again, infectious rate or mortality rate should be much higher, but as far as density or population, I mean, I wouldn't think. It's surprising to me that those are the ones that have been hit so hard. Again, go to any large apartment complex, you've got 10 times the people and traffic and elevators and everything else.
But you don't necessarily have somebody going room to room like you would with like a CNA or someone like that.
Right.
Who's providing services from person to person, can take it from one person to the next, to the next, to the next in one day.
Right.
They could all be exposed
Just
within
like
a
a
24-hour
correctional
period.
facility, okay.
So, whereas an apartment complex, you may not even know who lives next door to you.
Right. Or have exposure to them. Okay.
Is that what we think in the nursing homes, that it's been probably brought in by staff and then moved from room to room, typically?
Yeah, it's either that or if it would be a new admit or something that's come from a hospital back into a nursing home or such.
But that again reminds me of the conditions. Again, it seems like if you're taking all the appropriate steps, again, whether it's at a correctional facility or a nursing home, that spread shouldn't have been that easy.
We're enforcing, I shouldn't say enforcing, we're help guiding nursing homes in any question. When they come back from a hospital, a lot of times they'll do just some self-quarantine into a room where they limit who's going in to try to isolate if that person were to be somebody that is contracted and has the virus. They don't spread it to the remainder of. So if all of a sudden they come back from a hospital and within that 2 to 10 days they start having a fever or a cough or whatever, they can be tested and then brought back out before it creates a problem for the rest of the nursing home. So again, it's a lot on the surveillance side, it's a lot on the contact tracing side, and again, in the nursing homes, doing all of the proper PPE wearing, things of that nature, and doing all the hygiene that needs to happen. That's how we're going to keep it out of nursing homes.
According to the KDHE, there were 1,192 deaths due to influenza-related illness in the 2019-2020 flu season. Is there any projection by the Kansas Health Agency or KDHE that COVID-19 deaths would exceed that number up to January Do we have projections?
Um,
It means that we have 125 deaths, if I'm projecting, and that's since March. If you project the numbers out, it doesn't look like we'll hit 1192.
Well, first, the number that you're referring to is a total off of the KDHE website, and that's a total for influenza contributing factor to death, direct cause of death, pneumonia direct cause of death, and pneumonia contributing factor in death. That's not all influenza deaths. So if you look at actually just influenza deaths direct, like we're looking in here, as week 17, we were at 136 for the state of Kansas in regards to influenza deaths. And we were at 125 in basically the first 45 days of COVID-19. So if you look at national statistics also in influenza, and again, I want to remind you, this is not flu. These are, yes, they're viruses, yes, the signs and symptoms. These are signs and symptoms that come from viruses. Viruses all look alike when you look at signs and symptoms of viruses. Influenza viruses, coronaviruses, they look a lot alike. But if you want to look at death statistics, the current national death rate is about 0.0013% for the flu. If you look at the national death rate as of yesterday, based off the amount of cases and everything else, we're at 0.0583% for COVID-19. The other side of that is influenza, we have safety mechanisms. We have some herd immunity, we have vaccine, we have things of that nature that are already out there against this, and we don't have that necessarily against COVID-19. So, yes, in the state of Kansas, we're at 0.034 because there's 125 deaths out of the 3,700 cases. That gets us a 0.034 as opposed to the 0.00013%. That's a nationwide average for influenza. So, do I think the death rate is higher? It is higher. I mean, if you look at that just globally already where we're at,
Statistically.
and we're looking at 45 days, we're not looking at a year's time frame. We're looking at 17 weeks versus we're looking at 45 days.
But if you extrapolate those numbers out, and I understand what you're saying about the pneumonia, but because
But Mike, you gotta
a
remember
lot of
right now,
times it's
everything's-
a contributing fact. You know, a lot of times the flu also affects people in a way similar to COVID-19 because
it's
a lot of times the people that are weakest and have pre-existing conditions, you know, it pushes them over the edge on
But again,
the
there's
death
no-
rate. But if we just look at, I guess, when people are, and this is a question that was posed to me, is if, you know, even if we have a little higher rate, when we look at what we're going to have at the end of the year, are we going to have more deaths than that influenza? And it's questionable when you look at those numbers.
I think the data that Jamie just used,
Cosmic.
yeah.
Go ahead, Vicki.
Yeah, Jamie, as a result of the social distancing and the reduction in size of crowds and things like that, do you project that those measures will also have a positive impact on the number of flu positive results?
Well, absolutely. I mean, one of the main things we've seen, if you go onto KDHE's website, for one, influenza is not a reportable for the state of Kansas. That is not a reportable disease. So how that comes in, and it's influenza-like illness is how that is actually reported in. The deaths are actually reported in if it is a contributing factor on the death certificate specifically. So just to put those out. We have seen a drastic decrease in influenza testing, reportables, everything else, because one, we've seen a decrease across the board within ER, hospital admissions, things of that nature, because people just quite frankly are not going to doctors, going to their, getting things done. We have reduced by half. Our call volume right now for EMS, we were averaging about 34 calls a day. We're now averaging 17 calls a day. So the call load has even dropped with this pandemic because people are, I think, one, fearful of going to a hospital and just being exposed. So The testing for influenza has gone down because, again, people are not going into doctor's offices to get tests, or if they don't feel well, they're staying home and just riding out the storm, if you will. I think our numbers are going to be skewed with this because, again, what we were tracking versus what we are tracking now are night and day difference from what the population is doing for healthcare right at the moment.
Hey, Jamie, this is Commissioner Culberson. I had a question about watching the national news. They're starting to do antibody testing to see how many people actually probably already had it and got over it and didn't even know it, because that would drastically change their figuring out the mortality rate. Because if you've got more people that have had it and been cured or healed of it, then that changes your percentages. Is the county doing any antibody testing, or is that up to the individuals that go through their personal medical provider to do that? Or
Commissioner, that's what I was speaking of, is the serology testing. That's what serology testing is the antibody testing. So again, we think that that's probably several weeks out for us because availability, FDA approvals, CDC, they're running those tests and trying to gather that data of what that truly means when they get that. I understand, the concept of, okay, well, you have antibodies, so that's not actually the true fact. If you look at the CDC and everyone that is studying that right at the moment, they're trying to solidify that and actually make sure that that is what that data is telling us from the test, and not just giving a false hope that, okay, you're okay, go back to work, and that's not, you have been exposed, your body created enough antibody from that, but does that truly mean that you are not going to be a repeat of having the actual virus again? That's what's being studied with serology right at the moment.
And is there two different strains that might not work for anyway?
On the mutations, there's a lot of information, and I'm going to tell you, I don't know all the mutations and things of that nature yet, if it's actually mutated or not mutated, or there's a lot of talk because of all the different symptoms that have grown with this. As it started out, it was basically fever, cough, fatigue, shortness of breath type. Now it's abdominal pain, it's rashes on feet, it's all sorts of things. So we're learning as cases come through and more of this is studied, the more information is coming.
Okay. I was just wondering if maybe that would be a way. The two big reasons to test for antibodies would be people that are going to be immune to it, and then it would also affect the mortality percentage.
And that's what we're hoping. And believe me, as soon as that is the statement, and that is, I'm on board, and we will figure out how that is the next phase of our testing here in our county. I've been trying to be as in the forefront of this as we can, and if that's something we have the capabilities of running those type of tests, we would get the CLIA waiver, we would do everything that we would have to do to do it. It just has to be the right time to do it, the right test, and so on and so forth.
Okay, that's what I was wondering.
Okay.
Mark, do we think there's any chance of, depending on what the governor's orders are later today, counties, especially those not impacted or more rural, going against the governor's orders?
I don't think anybody will publicly, be in opposition to the governor's orders, because that would be like defying law. It's a legal order. We are legally required to follow it. I don't think that it would be advisable for anybody to come out and say that we weren't going to. Do I think that there will be different levels of enforcement depending upon the county? Obviously. Like you've mentioned, there are counties that have 0 cases so far. I doubt that this even they may not even watch the news tonight to see what the governor says.
So, speaking of legal orders, since we're going down that road, this is a question for the county councilor, and Jamie, you can address it too if you wish, but the district judge, Judge Brome, issued a ruling on churches, and the governor signed a settlement agreeing to comply with that order. Does that make it so in our order or whatever document we come out with, assuming the whenever the time frame is on that, that churches would be exempted per the order of the district court.
Exempted to what
To the
extent?
extent that the settlement requires.
The action that was brought in the U.S. District Court in Wichita dealt with, I believe, 2 specific churches. So the order of the court would actually only be applicable to those 2 churches. The gist of the order, and I think the basis for the judge's ruling, was that he believed that the executive order issued by the governor singled out, as it were, churches from other mass gatherings. In reviewing the proposed plan that had been prepared for today, Mr. Lawfrey and Jamie and I specifically were careful to avoid creating any separate classification for churches that would not be applicable to other entities. Quite frankly, you cannot create a restriction that singles out churches to the extent that it's discriminatory and impacts the freedom of religious worship. That would be really the effect of the ruling. It does not mean that an executive order could not apply to churches.
Now, the settlement that the governor entered into with those plaintiffs would be something that possibly could bind her in whatever order she issues.
It would bind her with respect to those 2 specific churches. And I'm not familiar with the settlement agreement because no one ever asked me my opinion on it.
My understanding is that she agreed that in any order she would advance, she would comply with the real concern is that we're allowing 150 people at Walmart. We're asking them to maintain social distancing. We allow them at Lowe's, at Home Depot, but then we're specifically carving out churches, and we're saying that, if you maintain your social distancing, if you follow all the rules, then you also ought to be able to
We aren't doing
comply.
that.
Yeah,
though.
Commissioner, I don't
No,
believe...
I'm not talking about our order. I'm just talking about in general what the
Well, that was the argument raised to challenge that executive order. That argument prevailed, and any executive order future or any order from this body issued prospectively should not discriminate against religious worship.
and that's, we certainly are in favor of following the law to the extent that it is constitutional.
Yeah, but I think the big takeaway here is that we've had a lot of discussion and there is consensus that we want to get open. We want to do so safely, right, with good policy. And there's a lot of best practices out there that most businesses, regardless of industry, should be able to manage to. Social distancing and, so I know we talk about no gatherings of 25 or more, but you just gave examples of where that happens constantly. But they are following the other kind of stipulation, which is no more than 10 people, say, per 500 square feet. So sometimes, again, 10 people or 20 people on 1,000 square feet looks very different than 20 people on 10,000 square feet, right? So again, social distancing and good CDC best practices. And only problem is we can't do any of these things if the governor won't let us.
That's correct.
Right.
Now, I did something specific, like on the big box stores. If we had sufficient quantities of masks through the health department, or could make if we did, just like scenario, could we have the stores offer the masks as people, like the greeters hand out the masks as they enter the store?
I think, again, the recommendation, we're not going to have at any point in time enough to be able to be that supplier for a big box store or such from the health department. That's not.
But if we required them, if they have availability.
We're telling them that's what the best practice is and try to make that recommendation. And again, if they want to step up and be the big box store and protecting their people and making their store safe, that's going to also make my determination. Do I go to this store that's providing that or this store that's not providing that? That's
It's a good idea.
Absolutely.
But again, if we're saying, look, we want your, as a business staff, you manage your staff, you manage that business, you need to be focused on them. You need to strongly urge, request, put up signage, just like we have, of your patrons to do the same. And it's much more realistic for an individual to be able to obtain a single mask or make a single mask to be able to go into these businesses and not put additional strain on a business owner that I assure you has had all the strain they want. Not Walmart, but small businesses.
Right.
Put additional burden on them is what I'd like to avoid.
I'm just thinking of the few that we've carved out that we're allowing so many people to be in. You know, we have, the only places where I see large gatherings now is at those places, those big box stores.
Yeah, I think it's important to point out that those types of organizations are covered under the KEFF, which is basically the Kansas Essential Functions Framework, I believe is what it stands for. So they are and will continue to be, regardless of what happens today, those are still within the they have different guidelines. That our order actually, we acknowledge that that's there because we can't supersede that. That's what's already in place. It's the same thing that the president put out as essential functions, that no local orders can shut down utilities, for instance. But, if this board wanted us to try to make a bulk purchase of the masks like we're wearing here and make them available to small businesses, because right now it's actually probably easier to buy 10,000 masks than it is to buy 100 masks. No, we could do that. But at some point in time, we don't have enough. And who do we hand them out to? It really is in their best interest to start trying to acquire them if that's what they're going to require. Costco put out an order yesterday that said nobody in their stores anymore that don't have a mask on. I think you'll see the other box stores follow suit with that. And they're not saying they're going to provide masks to you if you go to Costco. They're saying you're not coming in if you don't have a mask on, so go get a mask.
Only problem was availability then.
You make your own.
You make one. There's only about 400,000 YouTube videos on how you can make your own masks, and
well, that's the other reason. I'd like to get some of these other businesses open. Maybe they could take advantage. I mean, there are businesses here in the Leavenworth area that are probably very well suited to help create the same type of solution people are looking for. But
and we have had some local, actually the masks that the health office has, and some of the ones we're starting to circulate to our other employees, those came from local business that they are voluntarily making them. We're trying to pay them for them, and they're doing it strictly. They donated them because they understand the importance for our employees.
Well, businesses like those, and I was talking to Jamie about different vendors that have brought up food and things like that for his team and staff. Anything we can do to help, obviously, thank, promote, recognize, we should, because that's going above and beyond. I mean, that's what the news should be reporting on. Unfortunately, they don't. So.
Yeah, so it really is an amazing support system that we've had, and I think. I know we like to say that that's the Midwest, we have the Midwest, but I think if you look around the nation, that's happening everywhere. People are people are good. Okay. Not always, but typically.
All right, then we're going to meet tomorrow at 1 o'clock. Is that what everybody agrees on? That'll work for everybody? Everybody will be here? Okay, then I'll entertain a motion to adjourn until tomorrow.
Anybody on the phone have anything else?
Nope, I don't.
Nothing here.
I have one more question for the county councilor. On the quarantine statute, I had an attorney brought up to me that under that statute, there's a 72-hour request for a hearing provision. Does that apply to our order?
Your orders don't in any way affect the state statutes regarding quarantine or isolation. And I think there are perhaps a misperception. There are specific statutes that authorize your health officer to quarantine you. Right. And that's an order specific to you to require you to quarantine yourself. If you violate that order, there are civil enforcement mechanisms. There's actually even a criminal penalty attached to that. Likewise with the isolation statutes. Your orders are not those. Your implementations and the state executive orders are separate from those two specific statutes. So you're talking about two different scenarios. Quarantine applies to a specific individual.
Okay, but prior to the executive orders issued by the governor, our local emergency order cited the statutes that dealt with quarantine.
It dealt with general dealing with infectious diseases. Quarantine is a part of that.
And is there
That's a little different than the general public.
Well, I'm just said this was asked to me, does that allow, that provision where you would have the 72 hours to appeal, is that only if you specifically were quarantined to your home, or does that deal with, in general, if there's a request that everyone stay home?
Well, I truly do enjoy hypothetical questions, because you could, how much time do you have, Commissioner? Actually, the short answer would be, it applies to the specific individual. If a person wishes to challenge your orders, they have the right to do that, so they can file it in federal court or state court. I'd like to point out that I think the real enforcement of your orders is similar to what we have with respect to open burning in the county. It's 99.99% voluntarily complied with, because people realize it's for the common good, not to have you set your neighbor's properties on fire. So I think that's really where the enforcement comes from, is people wishing to do what's the common good.
And absolutely, and that's what I think. I think overall, Jamie, you're doing fantastic, giving the recommendations, putting it out there, what the data is, what the research is, laying it out, and in the end, no matter what we pass here, it's up to individuals to protect their family, protect yourself. You know, use your judgment. You know, if you're outside on a walk and there's nobody around, you're probably good to not have a mask on. Because I know one of the provisions said when you're in public. Well, you know, use your common sense. And
Like not going to large gatherings without a mask?
I think it depends how you define it.
Hey, Mark, just real quick, I have a question. We haven't heard anything more about the funding from the feds, have we? So when I mentioned, some of these counties that may have some issue with the state keeping 70 or 80% of the funds that the federal government intended for the counties, kind of like the LVTR that we've talked a lot about.
Right.
So I don't necessarily think it's a one-for-one as far as everybody following
Right.
law.
So far, they have retained 100% of the money they've received from the federal government, and they have not communicated to the local governments in any way, shape, or form how we might go about acquiring our designated, not like what we think we're owed, but what was designated to the local governments from the federal government. We haven't received even the guidelines on how we go about asking for that money yet.
So I just, again, want people to know, anybody that's watching or interacts in the political scheme and with our local representatives, that right now, we can't do anything because of the governor's orders, and right now, the state has kept 100% of the funding intended for the counties, so anything anybody can do to help with that would be great.
Yeah, and
Counties and cities.
Counties and cities.
Counties and
Thank you.
cities.
Counties and
The total
cities
for
and
the
counties.
county, we estimate to be somewhere around $15 million that the state has either received or should be receiving, that they still haven't even let us know how we can go about asking for it.
Last I heard, we were waiting on guidelines to how to distribute the money.
We're still
By
waiting.
wire or check is fine.
Yeah.
Yeah, I'll go drive over and pick it up in stacks of 20s if that's the way they want to do it. So.
Okay,
Okay.
thank you.
Yeah, I think a lot of people know that we really do and are concerned about all the folks that are without jobs and their businesses are shut. And we all care about them. And I know there's a lot of people tuned into this meeting today and are very concerned that they thought they were going to get to open their business. And it's very unfortunate that the governor waited so late in the week. I think that's very disappointing and actually poor leadership on her part. But I hope she comes out with something that's reasonable tonight.
And then we can open up on May 4th after May 3rd is lifted. And that's what I'm hoping that's what's going to happen, and I'm pretty sure we'll get it worked out tomorrow. And I wish we could have got something passed today so the public could know how to plan for Monday morning. But I'm sure we'll get something passed tomorrow. I'm confident. So with that, I'll entertain a motion to adjourn.
So moved.
I got a second? Did you second? All right, have a motion and a second. Voting?
Aye.
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 Commissioner Cox, aye.
Commissioner Culberson?